Hey gang, it's Dr. T, and today I wanted to do a little patient demonstration. So I wanted to educate you guys a little bit on what a breast lift or a mastopexy actually is, because I think there's a lot of misconceptions out there. So we're going to use our nice patient here, pre-op patient, and I'm going to give you some landmarks and describe what we do with the surgery. So what is a breast lift, a mastopexy? So a breast lift is not where we're taking the entire breast and lifting it up. Okay, that's not physically possible. What we are actually doing is moving the nipple areola back up to where it belongs. Okay, so for that, I'm going to show you a couple landmarks. The first important landmark, we call this the inframammary fold. So that is a natural fold that you have that basically delineates the lower aspect of your breast. Okay, so everybody's fold is set. Okay, and it's in different places and different people, but in general, you know, down, typically it's kind of near this part, this distal third of the arm. Okay, the top border of the breast is essentially, you kind of see how it dips in right here, right there, right there. So that is the top border of the breast. And that also basically doesn't necessarily change. We can add implants to kind of fill it out up here, but it tends to drift down back to this area because this frame of the breast stays constant, right? So I can't take this frame and move it up here. So if you want a breast that's up here, that can't be done because obviously we can't move this fold and we can't move this top border really, but we can fill it out to make it look more lifted. We can raise the nipple, okay, to an extent, to make it look more different. So that's what a breast lift is. And the reason why sometimes we have to do that up and down scar is we move this nipple up to a new place here where it belongs. And then we have to close what it used to be, so then you end up with that lollipop incision, that up and down scar, and a little bit at the bottom here we have extra tissue. So a breast lift. I'm going to show you from the side. All right, from the side, and just relax here for me. Okay, so this is kind of the mid, we call this the mid-axillary line. Okay, so that's basically divides your body. All right, front and back. I'm going to draw a line from her inframammary fold. So that is the bottom of her breast. That will always be the bottom of her breast, okay, no matter what. This is the top. Okay, so that is going to be the top, almost no matter what. It can be more filled out. It can kind of, you know, there's an implant can kind of bring this out here, but ultimately, that is her breast. This does not move. I cannot take this and move this up here any more than I can take my nose from here and put it up here. Okay, I can raise the tip, but I can't move the entire nose up here. So same thing with the breast. We can't take this and move this up here. It's impossible. Okay, no one can do that. What we do is there's an angle. So if you take from her nipple up here, we can raise that angle and rotate the breast up, kind of like rotating the tip of a nose up. We can rotate, so that's what we're doing, is we're moving the nipple up so that we're changing the nipple angle from here, which is a grade 3 ptosis, grade 2 ptosis, up to like a no ptosis. Sometimes we want to point up just a little bit. But basically, that is what a breast lift is we're moving the nipple angle from down here to up here, okay? This stays the same, okay? So we can't do that. So, final summary, breast lift, moving the nipple back up to where it belongs, removing a little tissue from below. We can add implants to give you more fullness and change the angle of your breast and nipple, but we cannot be in there. So that's what a breast lift is. It's really a nipple areolar lift if you're really going to describe it accurately. But anyway, so that's the breast lift, and I do a lot of them, and I love doing them. I think it's a fantastic procedure for rejuvenation of the way the breast looks, but you have to fully understand what we're actually doing and have reasonable expectations as to what the result's going to be. So if you have any other questions, I have a full page about Mastopexy on our website, lots of before and after pictures. I'm Dr. Breast and Body, Chicago Breast and Body Aesthetics in Chicago. I'll see you guys soon.